Emergency services, tell me exactly what happened.
A guy come off his motorbike. He's unconscious. He's not moving.
A 76-year-old motorcyclist has crashed in country Victoria and is critically injured.
Now, I just want you to go right next to him, check on his breathing, and I want you to say the word now every single time he takes a breath in, starting immediately.
Now.
Next one.
Now.
And one more.
Now.
Good. Is he still not responding?
No, he's not responsive.
Send them back, thank you.
The patient is more than 100 kilometres from a major trauma hospital, so an air ambulance team has been dispatched.
BTA there, yeah, Penny, 26.
There's not many 70-odd-year-olds riding motorbikes. Fantastic to hear, but it's also quite concerning that someone of that age has had a major traumatic incident.
Okay, clear doors, stand by, master caution.
While motorcyclists make up less than 1% of all kilometres travelled on Victorian roads, they account for nearly 20% of all deaths.
So a bit of right to left slope, into that hard ground. That'll do us.
As Ray and the team arrive at the crash, a local ambulance crew is already treating the barely conscious patient.
He's come off his bike, come through here.
And then, yeah, okay.
Carl was out riding with mates when he swerved to avoid a branch on the road and lost control.
Carl, how you doing? Been better? All right, mate.
Can you cross your arms across your chest for me, please?
So Carl's crashed at speed. We don't think it's a ridiculously high speed, but he's ridden into a ditch.
Ready, set, go. Okay.
The ditch has then thrown him through some trees. So if you're still travelling at 40 and 50 k's an hour when you strike trees, that's not something the human body's designed to withstand.
Ready, set, go.
We're concerned that his head and his neck and his back and his chest and his limbs have absorbed all of that force. And for a 20-year-old, that's an incredible amount of force to withstand. For a 76-year-old, that could be fatal.
We've got to get you out of this unholy mess, okay?
I talked to my grandma the other day because she's got the Facebook.
Oh,
She calls it the Facebook.
It's a more leisurely start of shift for Steve and Perth-born Emily. Emily has just found out her grandmother suspects Steve might be more than a work buddy.
She saw the photos of you at my birthday in the Speedo at the pool. And she goes, oh my, I thought you must have gotten rid of Angus for a second there. I was
Is
like,
that what
no,
she said?
Grandma. Emergency services.
Their first patient is an elderly woman with pain in her left arm.
Okay, have you ever had a heart attack or angina?
I've had quadruple bypass.
Okay, I've just put a note in there that you've had a quadruple bypass. Okay, when was that?
I think 4 years, and then I had an eye removed because I had the shingles.
All right, I've got help organised for you there. I just want you to rest in there in the most comfortable position and wait for the help to arrive.
Okay, straight for 4Ks.
Because of the patient's history, she's immediately classified time critical, code 1.
Her heart's been under stress before. She's had a quadruple bypass.
A lot of stress. This could be
Another heart attack.
Yeah.
Having one heart attack increases your risk of having a second heart attack.
Hello.
88-year-old Trixie may be well enough to greet them, but the intermittent grabbing pain in her left arm is still a worry.
Oops. They did it then.
It grabbed you.
Left arm and chest pain, you should never dismiss. You only have one heart, and if you've got these types of pains, you need to make sure that you call 000 immediately.
Emily is doing her very best to find out the cause of Trixie's pain, but her patient is off on a tangent.
I went to the races yesterday, and I said, I think I'll have one glass of champagne, but just put it down, and they opened the door and it blew my champagne open.
Can I just go over the story? Because you're a chatterbox like me and I need to dive in here.
It's because I live alone and I never talk to anyone.
Well, next time we'll come and have a cup of tea.
It's a big pull on the heartstrings when Trixie's telling me that she doesn't really have anybody to talk to. But I really need her focused on her symptoms today so we can figure out what's going on.
And I talk when I'm nervous.
Okay, well, I'm going to take over. At the moment, Your heart looks good, but with your heart history, we don't like to take any chances, okay?
So the ECG shows that Trixie isn't currently having a heart attack, but we still need to further investigate why she's having these symptoms.
I'm not a person that wants to go to hospital.
I don't think many people do.
She's got pain down her arm and then her blood pressure is really high. And we worry about that because it's putting extra stress on her already compromised heart. And it can also cause things like a stroke.
It's gotten worse.
It's gotten worse, okay.
It's always a special day when I get to work with you, Al.
Well, you know, you're not the only one that's actually said that to me.
Longtime mates Al and Cam have just clocked on for the day. Together, these paramedic veterans have more than 40 years' experience behind them.
Oh, that's beautiful.
Yeah, I know.
What I love about working with Al is it's like just being with a mate.
MICA 30 received code 1.
Here we go.
Every now and then, something stressful will happen, but you feel as though they could throw anything at you that day and you'd get through it.
The team has been urgently requested to help out another paramedic crew.
We're about 12 k's away, but in city traffic.
The patient is struggling to breathe, and her blood oxygen levels have plummeted to under 90%.
Oxygen levels down into the 80s. That's somebody who's critically unwell. There are people that live in the community with oxygen levels in the high 80s, but they're people with chronic lung diseases, and often they're the people that you see in the street pushing around oxygen cylinders.
Follow the tram tracks.
If you're not getting enough oxygen, your heart might develop funny rhythms, you become unconscious, and with that unconsciousness, there's a potential for you to die.
Just want to go in and get a bit of a handover.
At the house, the first paramedic crew is already giving 54-year-old Rowinia oxygen. But she is still struggling.
How long have you been feeling unwell? A day, 2 days, 3 days, 4 days, 5 days?
What started as mild shortness of breath has taken a dramatic turn for the worse.
Never been a smoker? Never had any lung conditions?
Rowinia's survived lung cancer already, but her husband, Jamie, has never seen his wife this sick.
You're okay. We're looking after you, okay?
Rowinia's in severe respiratory distress. She's anxious. And I looked at the paramedics' faces and I could see a sense of urgency in their eyes as well. So it was clear she's critically unwell.
Go. We're going to be a little bit ungentle, okay? Just moving you up and out of here.
76-year-old Carl lost control of his motorbike, crashed into a ditch, and was catapulted into trees.
He's quite significantly banged up. He's conscious, which is a good thing, but he's confused. So already we're querying possibly a head injury.
Carl, where's that hurt? Does it hurt here on your pelvis? Right, okay. To your back. All right, mate. Okay, gotcha.
His back is also a concern.
Giving you some more stuff for the pain, mate?
Carl is probably more than likely got a spinal fracture. The pain coming out of that area is probably a bit too much to be just a soft tissue injury. A fracture around your spinal cord is enormously problematic.
We're going to need some bodies right coming down that ditch.
And there's nothing easy about extricating Carl from the position he's in.
Ready, set, go.
We all good?
We're in the bushes and trees, very uneven ground.
All right, watch the sticks.
And one false move, we drop Carl and his spine injury comes something minor to something major. We can't afford that to happen.
Okay, straight over the top. Pop it down.
It can significantly impact his life.
Done.
Well done.
Carl, wiggle your toes for me. Good man.
As Carl is moved into the ambulance for further checks, his riding mates have now broken the terrifying news to his family.
Oh, it was scary. It was really scary. I struggled for a bit. I went into a bit of shock.
Carl, I think your shirt, unfortunately, mate, has seen better days, all right?
Dad's a young 76. It doesn't occur to us that he is that old. He's still very much active. His mind is still very much there. But we kind of thought this could be it.
Is it sore? No, not bad.
So once I have Carl in the ambulance, it's an opportunity to properly assess him. So I was certainly worried about his rib cage, and he might have some fractures. And anytime you've got fractures to your rib cage, you've got potential for lung injury.
Carl, I'm just going to put some jelly on your tummy. We'll have a quick scan of your tummy and your chest, all right?
We can do an ultrasound scan, and what we're worried about is his lung inflating or not.
Deep breath, Carl.
Has it been deflated by perhaps a fracture to the rib, or has he got bleeding into his lungs? Now, either of those injuries can be potentially catastrophic.
Deep breath.
You sure I'm all right to go like this?
Yeah, oh my God, we're going to hospital. It's not for a fashion show.
It's going to keep
What's the dressmaker, see?
Oh, that's why.
Back in the city, 88-year-old Trixie is making sure she's looking her best for the trip to hospital to have her heart checked out.
Is that the lippy? You've got to take the lippy.
You've got a mask on.
She's hilarious.
I don't think Trixie realises that in hospital you have to wear a mask at all times, so the lipstick's redundant.
Hey, Gordon, will you bring the washing in?
Where's the key?
Trixie's thought of everything, including organising her neighbour Gordon to rescue her laundry.
Trixie, are you sure the lippy wasn't for Gordon?
Oh, no, Gordon and I are just pals.
Just pals.
Unfortunately, a lot of people don't have great neighbours that come and check on them like Gordon does, so I thought that was really special.
So how was the races? Tell me, what did you wear yesterday?
I had one of those pleated skirts.
Oh, lovely.
Grey, and I had a pink top and a bit of lace.
Oh.
As I'm driving along, I'm thinking Em has finally met her match. Trixie and her are both chatterboxes.
I changed my bed, I washed the sheets.
This morning, with your arm pain.
Yeah.
She's done more than me today.
I was going to say, she's done more than me in the whole week.
I thought, well, if I can't good, I don't want all dirty stuff laying.
You don't want people to find that.
Trix and I are having a great chat, but I'm constantly keeping an eye on her vital signs for any signs of deterioration.
Hold on, Trixie.
Sorry, Trixie.
It is coming down, though, your blood pressure, so my calming presence is working now, I think.
Not his driving.
Not his driving, no.
I just wish Trixie and I had more time to get to know each other and have a cup of tea and let her tell me all of her great stories.
We've got your lipstick and we've got the bag, we've got everything.
Oh, just lipstick, nothing else.
You are the best. I love you.
Trixie's going to need to go in for some investigation. She'll need an ECG, some blood tests to make sure that everything's okay with her heart, and hopefully she's back at the races in no time, having a good time.
Okay.
Well, I hope you haven't had a boring ride.
No, we really haven't. You have entertained us to the nth degree. Let's get you in.
As Trixie heads inside for a cardiac assessment,
Al might pop a little needle in if that's okay.
Cam and Al are under pressure to stabilise Rowinia, who is gasping for air.
I'll have a listen to your breathing and then we'll get you out and in the ambulance, okay?
The 54-year-old's just been cleared of lung cancer, but that recovery has been tough on both her and husband Jamie.
She's just coarse crackles everywhere. It's a good infection.
Given her recent history, she's probably got a really nasty infection on the lungs. Whatever it is, it's causing her a lot of distress, and our goal is to maintain oxygen levels as best we can and get her to hospital.
I can't breathe.
Yeah, I know.
We've commenced some treatment with some supplemental oxygen. The numbers are showing that there's slight improvement, but to look at her, I actually wonder how much more fight she's actually got left in her.
I can't breathe.
Yeah, I understand, love. And moving Rowinia, because of how critically unwell she is always a tenuous situation, because that extra bit of moving could be enough to tip her over the edge. And all the gains we've made in the house can be lost. Rowena, that's what we've got to get to, love, all right?
For Jamie, who's just been diagnosed with cancer himself, it's a lot to take in.
But just take your time.
Rowenia's been a fantastic help towards my cancer battle recently.
Nice and easy?
I look to Rowinia as in support.
Okay, now have a breather for a moment before we put your legs up.
And I love her. She's my best friend. She's the mother of my daughters.
How do you feel? Still no good, mate. We've just got to try and stay nice and calm.
Sats at 88.
Rowenia's blood oxygen has dived to a dangerously low level, and her life is now in the balance.
Now, Rowena, this mask will feel like it's hard to breathe against, okay?
So one of the oxygen delivering devices that we've got is a CPAP mask. It's a continuous positive airway pressure mask.
That holds your airways open and lets oxygen get into your lungs.
It actually improves their work of breathing, reduces their muscle use, but people feel as though they can't breathe against it.
I know it feels really scary. I've got you, okay?
It can be really distressing, but I've got to give it a go. The oxygen levels are critically low, and if not treated, she'll go unconscious and maybe die.
Hey, I've got you. You're okay.
It's about family adventures, making some positive memories and putting a smile on the kids' faces.
It's a day off for Mike, and he's volunteering his services for a very different kind of shift, with fellow paramedics Jemima and Steve on the special TLC ambulance.
So it's an ambulance, but it's not an ambulance?
We want to be child-friendly, so clearly there's been some artwork put around it to make people feel comfortable in here.
The Fun Ambulance is all about giving children in palliative care a break from reality.
I can't imagine being full-time with a sick kid at home and giving them this opportunity. It's awesome.
Jemima started the Love Project after a family tragedy.
I had twin girls at 24 weeks. That is way too early.
Yeah, wow, I didn't realise.
Ava died at a month old. And Emily died at 7. So we spent half of Emily's 7 years in hospital, and your day's just full of clinical stuff, whether that's a whole lot of medical appointments, and Emily was attached to a lot of machines, so you end up really stuck. And one thing you want to do as a parent is let your kid be a kid. When kids do pass away, all you've got left is the memories, and so this is about trying to create those positive memories that the family who's left behind can still have.
Yeah.
Come on, Mum! Today is not just about 12-year-old Steffi, but also Mum Kylie, who is her full-time carer.
Hey! How are you, Steph? You ready to go to Science Works?
Yeah. So Steph has mitochondrial disease, which is a rare genetic disorder. Steph's body doesn't produce enough energy and just gradually shuts down. When she was 10 weeks old, she lost her vision. When she was 2, it affected her ability to walk. When she was 3, it affected her hearing. It causes just progressive damage to pretty much every bit of you. Hey, love. Hi. But Steph is remarkable in her ability to make the best of what she's been given.
Have you been to Science Works before?
Yeah.
Yeah, what can you tell me?
I can tell you it's a building.
Yeah.
There's some works there, and there's also some science there.
Cheeky girl.
Okay?
Yeah, okay. It's really special to come out with Steffi, to go through everything she's gone through and her family's gone through, and to still have that huge infectious smile is just incredible. Here we are.
All right, let's go. Come on.
Oh,
let's do it.
I can't walk that fast.
The good thing about today is you're going to have lots of fun and just get away from the hospital and all the worries.
Get ready.
Get set.
It's the most amazing day for us and for Steph. It's also about seeing me be able to let go and enjoy being a mum.
It's a really warm, fluffy day for me. I get to hang out with a cool little girl, have heaps of fun.
Come on. How good's that?
And when I see her big smile and her mum's sort of relieved smile, it makes my day.
Thank you.
Emergency services, tell me exactly what's happened.
I just walked past a cyclist and he's fallen off his bike. He's got a fair bit of blood coming out his head.
And is he awake?
Yeah, he is. He's just squatting down, but there's a fair bit of blood coming out.
All right, we'll get some help.
25-year-old male. There is serious bleeding.
New partners Taney and Marley are on their way to the injured cyclist.
Tell you what, I've recently got back into bike riding.
Have you?
I have, yep. I might have spent more on my helmet than I did the bike. Safety first.
I take PPE so seriously because I see, people have really awful injuries, not only externally but internally, and I just don't want that to happen to me.
So I wear a mouth guard when I'm riding because I'm worried that I'm going to fall off and knock my teeth out because I've seen it happen too many times. And safety goggles for my lashes. Cover those lashes.
Whilst I'm a massive advocate for protection while cycling, only Marley would worry about her lashes flying off. She must be getting up some pace on that bike.
I do not want to be a 29-year-old female with front teeth missing. I'm sorry, it's just not attractive.
And a mouth guard? That is next level.
Alrighty. Oh, he's walking. We're up.
Oh, okay,
we're already up and away.
As we arrived, we could see a patient being assisted by bystanders.
I'm Nick.
He looked really pale, and there was blood all over his head and face.
You right up on your feet?
I feel pretty nauseous and lightheaded.
He's feeling nauseated. These aren't the best signs.
All right, first of all, what happened?
I was pulling over to call someone and I took my helmet off first because I'm an idiot.
Yeah, well, that's nasty.
Yep.
Oh no, don't say that. Undo.
His injury is really significant. It's at least 15 centimetres in length and quite deep.
I'm going to give this a clean up, mate.
So it could have caused a concussion, a skull fracture, or an internal brain injury.
Before we do anything else, did you sore?
Yeah, it's pretty sore, sorry.
When I just palpated that then?
Yeah.
He also has C-spine tenderness. That causes grave concern for us. An injury to their neck is something we take really seriously because you could end up in a wheelchair.
We're going to lay you flat.
Deep breath, Carl.
Back in Victoria's high country, flight paramedic Ray is worried 76-year-old Carl could be bleeding internally after a frightening motorbike crash.
And it looks pretty square around there, you reckon? The ultrasound's clear on both his lungs and his tummy, so that's good.
Guys, I'm happy to get rolling. Yeah.
We can get on with getting Carl into the helicopter and get him off to hospital.
And roll around. Just going to go in this side here. Carl, that groaning, what's going on? What hurts? The back?
Yeah.
All right.
I'm still concerned about Carl full stop, really. He can move everything, good signs. But he still may have a spinal fracture there, so moving Carl's delicate.
All right, whenever you're ready, bearing in mind he's got a sore back.
Yeah. Ready, set, go.
Spinal fracture on anyone at any age can have enormous ramifications on the quality of their life and their ability to recover.
It's not how the day's meant to end, is it? Can you remember what happened, Carl? No?
Carl's still awake and talking to us, but he is confused about the incident.
Carl, just some earphones, all right?
Now, that could mean he's concussed, or it could mean he's got a bleed in the brain that could potentially deteriorate. If he's got a bleed in his brain, which we can't exclude, it's life-threatening.
All right.
Airborne ETA there, 1351.
His kids would be enormously worried about him.
Carl's daughter Sam is on her way to meet them at hospital.
Dad's been riding a motorbike since I can remember. He's always had a bike in the driveway, always had a leather jacket hanging in the wardrobe, and he's had a few accidents over the years and he's just gotten back on, which I guess says that that's how much he loves it.
Looks pretty good for 76.
Riding a motorbike still. Yeah.
But this time, being airlifted on you, it was serious, and I can't imagine a life without Dad.
M5, just at the pad of the Royal Melbourne.
I can't imagine how Mum would cope with losing Dad and how we would cope, how the kids would cope with losing Pa.
Let's get you inside and have a good look at you.
I'm going to hold your neck at the front. We're just going to put that collar on.
26-year-old cyclist Nick has a gaping wound on his head after a nasty fall from his bike. But Marley and Taney are more worried about neck or spinal injuries.
The neck brace really stresses me out.
Does it?
Just makes me feel like there's something wrong.
We just have to treat for the
I
worst
understand.
and hope for the best, hey? So if you've injured your spine, there's a great potential if you've had a small injury to make it quite a catastrophic injury with movement, like paralysis. So it's so important that we do keep them straight so they don't have this horrible outcome which would be life-altering.
To manage Nick's pain, Marley needs to get IV access.
Donate plasma every other week.
What a legend.
You've got good veins then.
Kind of an X marks the spot on that arm.
It does look that way, doesn't it? His veins are huge, and given how much he donates blood, there shouldn't be any trouble getting a cannula in to give him some pain relief.
Sharp sting. Got really thick skin.
You could drive a truck through his veins. They are huge.
Sorry, Nick.
Wow. Normally needles are fine.
And I think I was a little bit overconfident and completely missed.
Well, my nausea's okay now, actually,
Yeah.
but maybe that's just because I've been thinking about my arm.
Yeah, good on.
Sharp sting.
There we go. Done.
Thankfully, I redeemed myself and we were able to cannulate Nick a second time round. And we were able to get an anti-nausea drug on board and pain relief.
Do you just ride everywhere?
Yeah, I really like riding bikes, actually.
Yeah. Do you wear a mouth guard to ride?
No, should I?
Well, hear me out here. I was telling Taney on the way to this job that I wear a mouth guard because I've seen too many people lose their teeth, and I just think that teeth are so valuable that I just don't want to lose mine.
I thought it was more a bite off the tongue thing.
To be honest, I'm not as concerned of losing my tongue. Aesthetically, I'd rather have my teeth.
Taney may laugh at how safe I like to be, but this is a great example of why I do it. I just don't want to have that happen to me, as I'm sure, most people don't want it to happen to them, so wear your PPE.
Gotta try and avoid telling my mum this at all costs.
Yep.
So, outbound.
Yeah, onto the freeway.
In the inner west, MICA paramedics Glennis and Dodsey are one of multiple units responding to a bizarre case.
Let's follow this guy.
A man has driven into a construction site that is part of a new freeway extension and crashed into a truck.
Car versus a truck.
Yeah.
E59 or W60.
See how everyone else has moved?
There's no address, so they have to rely on a vague location description instead.
I'm super confused, I'm sorry.
This patient sounds like he could be really sick. And having the stress of driving in heavy traffic amongst roadworks with no real instructions where it is makes it very confronting.
Got it up there.
How the hell do you have a car accident in there? This is one of the most bizarre cases we've ever been to. Oh, this is interesting. How did he leave a fast-flowing freeway, find a tiny little access point? Oh, how did that person get in there? Get 100 metres in it and hit a stationary truck.
Not a bad smack, though.
What led to all these circumstances today? All right.
Shocked construction workers witnessed the smash and then helped the man out of his crushed car and put him in a work vehicle.
Who have we got?
So Ralph is 76. He's driven up here on the dirt and he's crashed into a stationary truck and he doesn't know how it happened.
It's good impact on the front of the car. Yeah. It's just stopped abruptly by the truck.
So one of the workmen tells me he got airborne like Evel Knievel. He's taken off over a ramp and hit the truck full on, face first. He's dazed and he's confused. So there's a lot of questions we have to ask, whether he's had a stroke, whether it's other neurological causes.
He's got no bruising on his chest, but he says that he's got a sore chest.
And he looks okay at the moment, but we know that the car and himself went through a great amount of trauma. So from his head to his heart to his entire body, there's a number of problems that can occur and they all can be life-threatening.
Oh, he's got the shakes.
You're doing really well.
Cam and Al need to get 54-year-old Rowinia to hospital urgently.
Here, give me a hand.
Her life is in danger unless they can bring up her critically low oxygen levels with the help of a specialised air pressure mask.
Okay, nice and easy, Al.
Righto.
The mask is highly effective at increasing your oxygen levels in your blood, but it's distressing.
Oh, you want to take it off? Once it's on, we should leave it on. I know it feels really weird because it's blowing into your face, so you feel like you're working against it.
I've got to try and sell it to Rowinia that this hopefully will make her feel better, but she's got to overcome the mind game and accept it.
Feel pretty crook? Yeah, I know.
And I'm not going to see instant gains. In fact, often people get a little bit worse before they get better.
So you had some chemo and then they've scanned you and they said no more cancer. Is that right? That's great.
Although Rowinia has beaten lung cancer, her health is still severely compromised. Cam and Al are certain she now has pneumonia, with one or both of her lungs seriously infected.
Blood pressure's still 100, Al.
Okay, so we're septic, obviously. Rowenia's got her pneumonia, which is an infection. Leave that too long, and what can happen is sepsis, which is a more global infection that can lead to death.
I know, Rowenia. I can see how much you're struggling.
Cam, not far.
Just pulling into the hospital, okay? Are you going great? You're right.
We get to hospital and she's still got the mask on.
No, you can't take it off yet. No.
But with respiratory conditions like this, especially with somebody with such a complex medical history, anything could happen from here. But she's in the best place to get it sorted.
Doing really well. We'll get this mask off soon, see if they can work out exactly what's happening.
Rowenia's got all these lung issues, and unfortunately, it's a little bit of a knife edge for her in terms of surviving this event.
Just relax. I've still got you.
Use me if you need to, bud, all right?
In the middle of a freeway construction site, Glennis and Dodsey are transferring Ralph to their ambulance.
Just take your time, mate. It's no rush, yeah?
The confused 76-year-old has no idea how he got there and crashed into a stationary truck.
I'm going to help you spin your pegs.
Swing them up, buddy.
You got pain there, mate. OK.
When the car's been through that much trauma, not only does he have potentially cracked ribs, but he could have a spinal injury or a neck injury. So we have to look after his neck as best we can.
You got to cut the clothes?
Yeah, darling, I do.
The worry is Ralph may have had a seizure or a stroke, which would explain the bizarre accident.
Do you remember what happened, love?
No, I had an accident.
I know. Where do you live, darling?
Berwick.
Berwick, and you were heading out to where?
The mansion.
Is it woodworking, Ralph?
Mm-hmm.
And where's that, love?
In Berwick.
And do you know you're over in Point Cookway today?
No.
Okay. If it was confusing before, it gets even better. Ralph comes from Berwick, and now he's 75 kilometres from where he's supposed to be.
You got some pain relief?
I do, darling.
I'm getting pains in my arm.
Yeah, that's me. There's something not quite right. So my thoughts keep coming back to the idea that something neurological's happened. Just really easy. How old are you, Ralph?
76.
76. What's your wife's name, Ralph?
Elizabeth.
Elizabeth, and how long have you been married?
We were married in 1970.
Wow. How many children do you have, Ralph?
2 children, but one's deceased.
Oh, I'm sorry to hear that.
She had an epileptic fit.
Did she?
And she died in a swimming pool in America.
Was she on holidays?
Yeah.
Oh, love. It can't be anything worse, can there?
No, she was only 46.
Oh, a young lady, hey?
Yeah.
Now, how young did you say you were, Ralph?
74.
Poor Ralph. He says that he's 76. He now says he's 74. I want to see how well you're giving my hands a big squeeze. Give this one. Oh, that's nice and tight. Thank you very much. Now, raise both your arms up in the air. Good. He seems to have passed all the preliminary stroke tests, but there's something neurological going on. I'm very concerned for you today, Ralph. I'm not sure what happened. And what I do know 100% is he should not be driving.
Just pulling in, Glennis.
And I don't take that lightly. To say to take someone's licence away means we take away their independence. But Ralph's a lovely man. How would he felt today if he took someone's life or caused a major accident?
And we're going to take good care of you, mate, all right?
Sorry, Tony, our BP 150 on 76, heart rate of 75.
Marley and Taney are on their way to hospital with injured cyclist Nick.
So just going to have a quick feel. Tell me any pain anywhere else.
He suffered a deep gash to his head and has been given a protective neck brace. But Marley is now looking for any other medical issues.
Gosh, there's a lot of length. 160?
I think the word you're looking for, Marley, is tall.
200 centimetres. It's quite a workout for someone that's only 160.
And unfortunately, I just used the wrong word at the wrong time, and I don't think I'll ever live it down. I look at Taney for some support and help to backpedal, and all I hear is giggles. Nothing. She gives me nothing.
But I am actually starting to feel nauseous again.
Nauseous, okay.
As much as we're having a joke and having a laugh on the way to hospital, I'm very aware that I'm continually assessing his conscious state.
And what about the pain?
I still have quite a big headache.
Okay, we'll give you some more pain relief.
Injury to the brain isn't something that always presents itself immediately. It can happen like hours later. So keeping him alert and chatty is really important until he has a scan of his head and he's declared safe by the doctors.
I can't believe I didn't have my helmet on at the time. Like, it was just so dumb. Like, I was feeling pretty good at that stage, so I was fine to walk up.
By all means, like, we have ways to get to you. Like, when you're injured, you have an adrenaline rush and you have a nervous system response which releases all this adrenaline. You don't really feel pain like you would normally. And also, when you know you've got your head injury, that gives you a distracting injury. So you might have injured your neck more than you are aware of. But in future, if you just lay there, we'll sort it out, okay? And how's your pain doing at the moment?
I'm getting a worse headache again, actually.
Worse now?
Yeah.
When we arrive at hospital, his headache is getting worse. So he's probably going to have a CT scan to check that there's no bleed.
I'm just stressed about my neck.
He might have his neck scanned because he's got the pain on his neck. He might even need plastics to fix that cut. It's quite deep and it's quite large and it's right in the middle of his forehead.
Nice and still. You've done really well so far.
I hope for Nick that it's just a few stitches and he's on his way, but the reality of today is that it could be a lot worse.
It's been 5 weeks since 76-year-old Carl had a high-impact crash on his motorbike.
Well, we've got to get you out of this unholy mess, OK?
Doctors confirmed he had broken his back, sternum and collarbone, as well as suffering cracked ribs and a bleed in the brain.
So how many times a day do you need to walk to help your back?
I've got to walk a couple of times a day, half an hour a day.
His bike may have been written off, but Carl can expect a full recovery.
They have my extreme gratitude for the guys who picked me up and the doctors and nurses in the facilities afterwards. Not for them, I wouldn't be here.
So, how are we going to convince you not to get back on a bike again?
Give us a lift up to Melbourne to look at the Rikers.
Oh, the three-wheelers.
Three-wheelers. I don't think I will go back on 2 wheels, so maybe I'll go to 3. 3-wheeler would be good.
Don't fall off.
No. I enjoy the freedom. I enjoy being in the open. So when can we go?
Oh, can you just get fully recovered first? I'm not happy. You know, enough's enough, but what else do you have if you can't do the things you love? How are you going to convince Mum?
Well, I just won't tell her till it's parked outside.
Oh, it's good. It's not going to go
And
down
it's too
well.
late for her to say no, don't.
Is that the lippy? You've got to take the lippy.
You've got a mask on.
88-year-old former dressmaker Trixie went to hospital with pain in her chest and arm. Tests revealed her heart was only working at 50% capacity. Trixie is now recovering at home and hoping she will soon be well enough to get back to the races.
Well, I hope you haven't had a boring ride.
No, we really haven't.
Yeah, well, that's nasty. Yeah.
Oh, no, don't say that. Undo.
Nick took a tumble off his push bike and was bleeding heavily. Scans cleared him of any brain injuries, but the nasty head wound required 6 stitches and 15 staples.
I can't believe I didn't have my helmet on, because it's just so dumb.
Nick is now following Marley's words of wisdom and has vowed to never ride again without putting on his helmet.
Oh, he's got the shakes.
76-year-old Ralph couldn't remember how he got into a freeway construction site and crashed into a stationary truck.
Really got pain.
At hospital, scans revealed several cracked ribs, but no signs of a stroke. Turns out Ralph had a brain tumour removed several years ago and has been struggling ever since. After the accident, Ralph was deemed unfit to drive. Luckily, his wife Elizabeth still gets him to the men's shed so he can continue with his beloved woodwork hobby. 54-year-old Rowinia was gasping for breath.
We're looking after you, OK?
Husband Jamie had never seen her so sick, despite his wife having already survived lung cancer.
You look a little bit tired.
Maybe have a nana nap this afternoon.
Yeah, that sounds good.
Nana nap?
Nana nap before the girls come home from school and wake up and you've done the washing.
Oh, I don't know about that. Some of the washing, some of the washing.
Rowenia was diagnosed with severe pneumonia and was in hospital for a week.
They're looking at giving me oxygen in the home, but at the moment, the medication that they've given me has been working.
Although it's another chapter in her long medical history, Rowenia remains optimistic.
I have Jamie and the 2 girls. They get me through everything. I've come through it, thankfully. A lot of people don't. And it just makes you think, don't take for granted what you've got today.